Flexibility training concepts. The purpose of this presentation is to provide the fitness professional with fundamental concepts regarding flexibility and the importance of proper flexibility training. This presentation will also allow the fitness professional to select and administer the appropriate flexibility protocol for all clients. Following this presentation, the participant will be able to define flexibility, describe the effects of muscle imbalance on the kinetic chain, differentiate flexibility and stretching techniques, perform appropriate flexibility techniques on all clientele. Today's society is plagued by postural imbalances, primarily due to sedentary lifestyles caused by advancements in technology. More people today are spending time in office-related jobs, which require individuals to sit for long hours. More than ever before, flexibility training has become a key component in developing neuromuscular efficiency and decreasing these dysfunctions. Flexibility training may decrease the occurrences of muscle imbalances, joint dysfunctions, and overuse injuries. Without optimum levels of flexibility, it is impossible to have proper kinetic chain function and performance. Flexibility is the normal extensibility of all soft tissues that allow the full range of motion of a joint. However, in order for soft tissue to achieve efficient extensibility, there must be optimum control throughout the entire range of motion. More specifically, this optimum control can be referred to as dynamic range of motion. This is the combination of flexibility and the nervous system's ability to control this range of motion efficiently. To allow for optimal neuromuscular efficiency, individuals must have proper flexibility in all three planes of motion. This allows for the movement needed to perform everyday activities effectively, such as bending over to tie shoes or reaching in the top cupboard for dishes. Flexibility training must be a multifaceted approach, which integrates various flexibility techniques in order to achieve optimum soft tissue extensibility in all planes of motion. To better understand integrated flexibility, a few important concepts must first be reviewed. These include the kinetic chain, muscle imbalances, and neuromuscular efficiency. As mentioned in earlier lessons, the kinetic chain is comprised of the muscular, skeletal, and nervous systems. Optimum alignment and function of each component of the kinetic chain is the cornerstone of a sound training program. If one segment of the kinetic chain is misaligned and not functioning properly, predictable patterns of dysfunction develop. Limited flexibility. Poor flexibility may lead to the development of relative flexibility, which is the process where the kinetic chain seeks the path of least resistance during functional movement patterns, or in other words, movement compensations occur. A prime example of relative flexibility is seen in people who squat with their feet externally rotated. As most people today have tightness in their calf muscles, they lack the proper amount of dorsiflexion at the ankle to perform a squat with proper mechanics. By widening their stance and externally rotating their feet, they're able to decrease the amount of dorsiflexion required at the ankle to squat and thus compensate for this lack of flexibility. This leads to muscle imbalances. Muscle imbalances caused by abnormal structural and functional efficiency of the kinetic chain are alterations in the lengths of muscles surrounding a given joint where some muscles are overactive or forcing compensation to occur, and other muscles may be underactive, allowing for the compensation to occur. Muscle imbalances result from or can lead to altered reciprocal inhibition, synergistic dominance, arthrokinetic dysfunction, and overall decreased neuromuscular control. Altered reciprocal inhibition is the concept of muscle inhibition caused by a tight agonist, which decreases neural drive of its functional antagonist. For example, a tight psoas, or hip flexor, would decrease neural drive of the gluteus maximus, the hip extensor. Synergistic dominance is the neuromuscular phenomenon that occurs when synergists take over function for a weak or inhibited prime mover. For example, when the psoas is tight, it leads to altered reciprocal inhibition of the gluteus maximus. The result is increased force output of the synergists for hip extension, hamstrings, adductor magnus, and erector spinae to compensate for the weakened gluteus maximus. Arthrokinetic dysfunction is a biomechanical and neuromuscular dysfunction leading to altered joint motion. Altered joint motion causes altered length-tension relationships and force-couple relationships. This affects the joint and causes poor movement efficiency. Neuromuscular efficiency is the ability of the neuromuscular system to properly recruit muscles to produce force, reduce force, and dynamically stabilize the entire kinetic chain in all three planes of motion. Because the nervous system is the controlling factor behind this principle, it is important to mention that mechanoreceptors, or sensory receptors, located in the muscles and tendons, help to determine muscle balance or imbalance. These mechanoreceptors include the muscle spindles and Golgi tendon organ. As mentioned in earlier lessons, muscle spindles are the major sensory organ of the muscle and are composed of microscopic fibers that lie parallel to the muscle fiber. Remember that muscle spindles are sensitive to change in length and rate of length change. When a muscle on one side of a joint is lengthened due to a shortened muscle on the other side, the spindles of the lengthened muscle are stretched. This information is transmitted to the brain and spinal cord, exciting the muscle spindle, causing the muscle fibers to contract. This often results in muscle spasms or a feeling of tightness. The Golgi tendon organs, or GTO, are located within the musculotendinous junction, or the point where the muscle and the tendon meet, and are sensitive to changes in muscular tension and rate of the tension change. When excited, the Golgi tendon organ causes the muscle to relax. This prevents the muscle from being placed under excessive stress, which could result in injury. Prolonged Golgi tendon organ stimulation provides an inhibitory action to muscle spindles located within the same muscle. This neuromuscular phenomenon is called autogenic inhibition and occurs when the neural impulses sensing tension are greater than the impulses causing muscle contraction. The phenomenon is termed autogenic because the contracting muscle is being inhibited by its own receptors. Autogenic inhibition is one of the main principles used in flexibility training, particularly with static stretching when one holds a stretch for a prolonged period of time, 20 to 30 seconds. Holding a stretch creates tension in the muscle. This tension stimulates the GTO, which overrides muscle spindle activity in the muscle being stretched, causing relaxation in the overactive muscle and allowing for optimal lengthening of the tissue. Let's next review some of the main reasons why flexibility training is important. We'll start by discussing pattern overload. Significant numbers of people in today's society have muscular imbalances that are a result of pattern overload. Pattern overload is consistently repeating the same pattern of motion. There are gym members who train with the same routine repetitively. This may lead to pattern overload and place abnormal stresses on the body. Pattern overload may not necessarily be directly related to exercise. Consider the person who has a particularly repetitive occupation, such as a loading dock employee lifting and loading packages all day. He or she too will experience a pattern overload from moving his body in repetitive ways on a daily basis. Even sitting at a computer is a repetitive stress. Poor posture and repetitive movements create dysfunction within the connective tissue of the kinetic chain. This dysfunction is treated by the body as an injury, and as a result, the body will initiate a repair process termed the cumulative injury cycle. Any trauma to the tissue of the body creates inflammation. Inflammation, in turn, activates the body's pain receptors and initiates a protective mechanism, increasing muscle tension and/or causing muscle spasm. Heightened activity of muscle spindles in particular areas of the muscle creates a microspasm. As a result of the spasm, adhesions begin to form in the soft tissue. These adhesions form a weak, inelastic matrix that decreases normal elasticity of the soft tissue, leading to altered neuromuscular control and muscle imbalances. If left unaddressed through flexibility training, these imbalances will lead to further dysfunction and eventual injury. To fully appreciate the principles of flexibility training, health and fitness professionals must understand the different types. Flexibility, like any other form of training, should follow a systematic progression. This is known as the flexibility continuum. There are 3 phases of flexibility training used in the OPT model: corrective, active, and functional. Corrective flexibility is designed to improve muscle imbalances and altered arthrokinematics, or joint motion. Active flexibility is designed to improve the extensibility of soft tissue and increase neuromuscular efficiency. Active flexibility allows for agonists and synergist muscles to move a limb through a full range of motion while the functional antagonists are being stretched. Functional flexibility is integrated multiplanar soft tissue extensibility with optimum neuromuscular control through the full range of motion. Essentially, Functional flexibility is movement without compensations. Thus, for an individual to possess optimal functional flexibility, they must possess optimal tissue extensibility, developed first through corrective flexibility techniques, and optimal neuromuscular control, developed secondly through active flexibility techniques. Within each category of the flexibility continuum exist specific forms of stretching techniques that would be most appropriate for the desired outcome. Corrective flexibility improves muscle imbalances and altered joint motion by using self-myofascial release and static stretching techniques. Active flexibility improves the extensibility of soft tissue and increases neuromuscular control by using self-myofascial release and active isolated stretching. Functional flexibility improves the extensibility of soft tissue and increases neuromuscular efficiency by using self-myofascial release and dynamic stretching techniques. We will first discuss self-myofascial release technique, as it is a technique that would be used in all three levels of the flexibility continuum. Stretching Techniques, Part 1. Self-myofascial release is a stretching technique that focuses on the neural system and fascial system in the body. By applying gentle force to an adhesion or knot, the elastic muscle fibers are altered from a bundled position into a straighter alignment with the direction of the muscle and/or fascia. The gentle pressure applied with implements such as a foam roll will stimulate Golgi tendon organ and create autogenic inhibition, decreasing muscle spindle excitation and releasing the hypertonicity of the underlying musculature. It's crucial to note that when a person is using self-myofascial release, he or she must find a tender spot, which indicates the presence of muscle hypertonicity, and sustain pressure on that spot for a minimum of 20 to 30 seconds. This will create the autogenic inhibition response within the muscle, allowing it to relax. It may take longer, depending on the client's ability to consciously relax. Self-myofascial release is suggested prior to static stretching for movement compensations, as a warm-up prior to activity, and/or as a cool-down. Let's now review some examples of self-myofascial release techniques, starting with calf complex. Place foam roll under mid-calf. Slowly roll the calf area to find the most tender spot. Once identified, hold the tender spot until the discomfort is reduced. This will be an important technique to implement when an individual has an excessive forward lean during an overhead squat assessment. The second example is for the TFL, or tensor fascia lata. Lie on one side, the foam roll just in front of the hip. Cross the top leg over the lower leg. Maintain optimal head alignment, ears in line with the shoulders. Slowly roll from the hip joint to place emphasis on the TFL. To emphasize the IT band, roll along the side of the thigh to lateral knee to find the most tender spot. Once identified, hold the tender spot until the discomfort is reduced. This will be an important technique to implement when an individual has an excessive forward lean during an overhead squat assessment. The third example is for the adductor. Lie prone with one thigh flexed and abducted and the foam roll in the groin region inside the upper thigh. Slowly roll the medial thigh area to find the most tender spot. Once identified, hold the tender spot until the discomfort is reduced. This will be an important technique to implement when an individual has adducted and internally rotated knees. The fourth example is for the piriformis. Sit on top of the foam roll positioned on the back of the hip. Cross one foot to the opposite knee. Lean into the hip of the crossed leg. Slowly roll on the posterior hip area to find the most tender spot. Once identified, hold the tender spot until the discomfort is reduced. The final example is for the latissimus dorsi. Lie on the floor on one side with the arm closest to the floor outstretched and thumb facing inward. Place the foam roll under the arm or axillary region. Slowly move back and forth to find the most tender spot. Once identified, hold the tender spot until the discomfort is reduced. This will be an important technique to implement when an individual's arms fall forward during an overhead squat assessment. The next technique we'll discuss is static stretching. Static stretching is the process of passively taking a muscle to the point of tension and holding the stretch for a minimum of 20 seconds. This is the traditional form of stretching that is most often seen in fitness today. It combines low force with longer duration. The proposed mechanism for this type of stretching is autogenic inhibition. By holding the muscle in a stretched position for a prolonged period of time, the Golgi tendon organ is stimulated and produces an inhibitory effect on the muscle spindle. Let's review some commonly used static stretches, starting with the static gastrocnemius stretch. Extend one leg back, keeping the knee and foot straight and the back heel on the floor. Draw the navel inward. Keep the rear foot flat, with foot pointed straight ahead. Do not allow the rear foot to flatten. Bend arms and lean forward toward the wall. Keep the gluteal and quadriceps tight of the back leg and the heel on the ground. Hold for 20 to 30 seconds. This will be an important stretch to implement when an individual has an excessive forward lean during an overhead squat assessment. The second example is the static standing psoas stretch. Stand with one leg bent and slightly forward. Internally rotate the back leg. Draw the navel inward. Squeeze buttocks while rotating the pelvis posteriorly. Slowly move body forward until a mild tension is achieved in the front of the hip being stretched. Raise up the arm on the same side as the back leg and laterally flex to the opposite side. Hold the side bend position and slowly rotate posteriorly. Hold for 20 to 30 seconds. Switch sides and repeat. This will be an important stretch to implement when an individual has an excessive forward lean during an overhead squat assessment. The third example is the static kneeling hip flexor stretch. Kneel with the front and back leg bent at a 90-degree angle. Internally rotate the back hip. Draw the navel inward. Squeeze the buttocks of the side being stretched while rotating the pelvis posteriorly. Raise up the arm on the side being stretched and slowly move the body forward until a mild tension is achieved in the front of the hip being stretched. Laterally flex and rotate to enhance the stretch in the frontal and transverse planes. Hold for 20 to 30 seconds. This will be an important stretch to implement when an individual has an excessive forward lean during an overhead squat assessment. The fourth example is the static standing adductor stretch. Stand in a straddled stance with the feet beyond shoulder width apart. Extend one leg back to the toe of the back leg is in line with the arch of the foot of the other. Both feet should be pointed straight ahead. Draw the navel inward. Slowly move in a lateral motion until a stretch is felt on the medial portion of the thigh. Hold for 20 to 30 seconds. This will be an important stretch to implement when an individual's knees move inward during an overhead and/or single leg squat assessment. The final example is the static latissimus dorsi ball stretch. Kneel in front of a stability ball. Place one arm on the ball with thumb pointed straight up in the air. Draw the navel inward and posteriorly rotate the pelvis. Slowly reach the arm straight out by rolling the ball forward. Hold for 20 to 30 seconds. This will be an important stretch to implement when an individual's arms fall forward during an overhead. Stretching Techniques Part 2. The next stretching technique is active isolated stretching. Active isolated stretching is the process of using agonists and synergists to dynamically move the joint into a range of motion. This form of stretching increases motor neuron excitability, creating reciprocal inhibition of the muscle being stretched, allowing for greater range of motion. Active isolated stretches are suggested for pre-activity warm-up as long as no movement compensations are present. Typically, 5 to 10 repetitions of each stretch are performed and held for 1 to 2 seconds each. Let's now review some examples of active isolated stretches, starting with the active gastrocnemius stretch. Stand near a wall or sturdy object. Bring one leg forward for support. Use the upper body and lean against the wall. The extended leg should form one straight line and the ankle should be in a neutral position. Draw the navel inward. Keep the rear foot on the ground with the opposite hip flexed. Slowly move through hips, creating controlled supination and pronation through the lower extremity. Hold for 1 to 2 seconds and repeat for 5 to 10 repetitions. The second example is the active supine bicep femoris stretch. Lie supine on the floor with legs flat. Flex and adduct the hip of the side being stretched while keeping the knee flexed. Place the opposite hand behind the knee of the leg being stretched. Draw the navel inward. With hand supporting leg, extend the knee. Hold for 1 to 2 seconds and repeat for 5 to 10 repetitions. The third example is the active kneeling hip flexor stretch. Kneel with the front and back leg bent at a 90-degree angle. Draw the navel inward. Squeeze the buttocks of the side being stretched while rotating the pelvis posteriorly. Raise up the arm on the side being stretched and slowly move the body forward until a mild tension is achieved in the front of the hip being stretched. Laterally flex and posteriorly rotate to enhance the stretch in the front and transverse planes. Hold for 1 to 2 seconds and repeat for 5 to 10 repetitions. The fourth example is the active standing adductor stretch. Stand in a straddled stance with the feet beyond shoulder width apart. Extend one leg back to the toe of the back leg is in line with the arch of the foot of the other. Both feet should be pointed straight ahead. Draw the navel inward. Slowly move in a lateral motion until a stretch is felt on the medial portion of the thigh. Hold for 1 to 2 seconds for 5 to 10 repetitions. The final example is the active latissimus dorsi ball stretch. Kneel in front of a stability ball. Place one arm on the ball with thumb straight up in the air. Draw the navel inward and posteriorly rotate the pelvis. Reach out with the ball out until a stretch is felt. Hold for 1 to 2 seconds for 5 to 10 repetitions. The final stretching technique is dynamic stretching. Dynamic stretching uses the force production of a muscle and the body's momentum to take a joint through the full available range of motion. Dynamic stretching employs the concept of reciprocal inhibition to improve soft tissue extensibility. One can perform one set of 10 repetitions utilizing 3 to 10 dynamic stretches. Dynamic stretching is also suggested as a pre-activity warm-up, as long as no movement compensations are present. It is recommended that the client have good levels of tissue extensibility, core stability, and balance capabilities prior to undertaking an aggressive dynamic stretching program. Let's now review some examples of dynamic stretching techniques, starting with prisoner squats. Stand in proper alignment with the hands behind the head. Draw the navel inward. Lower to a squat position, under control and without compensation. Toes straight ahead, knees in line with the toes. Extend hips, knees, and ankles. Raise onto toes. And repeat. Perform 10 repetitions. The second example is a multiplanar lunge. Stand in proper alignment with hands on hips and feet straight ahead. Draw the navel inward. While maintaining total body alignment, step forward, sagittal plane, descending slowly by bending at the hips, knees, and ankles. Use hip and thigh muscles to push up and back to the start position. Perform 10 repetitions. Repeat on the opposite leg. Progress to side lunges, frontal plane, followed by turning lunges, transverse plane. The third example is tube walking. Stand with feet hip-width apart, knees slightly bent, and feet straight ahead. Place tubing around the mid-lower leg. Draw the navel inward. Keep the feet straight ahead and take 10 small steps sideways without allowing the knees to cave inward. Repeat in the opposite direction. The final example, medicine ball chop and lift. Stand with feet hip-width apart, knees slightly bent, and feet straight ahead. Grasp a medicine ball with both hands and keep elbows fully extended. Draw the navel inward. Starting from optimal posture, initiate the rotational movement from the trunk outward, lifting the medicine ball from a low position to a high position. Allow the hips to pivot on the back foot as the motion nears end range. Perform 10 repetitions. Repeat on opposite side. Flexibility Training Program Design. For most first-time clients and those requiring correction of postural imbalance, corrective flexibility, or self-myofascial release and static stretching, is used prior to and following training sessions, as well as at home on off days. Corrective flexibility will be used in the stabilization level, or Phase 1 of the OPT model. In your textbook, make sure to review the table located at the end of the flexibility chapter for the appropriate flexibility and strengthening strategies of common compensations that may be present during a movement assessment. With a proper progression through the flexibility continuum, and as the client's ability dictates, active flexibility, which includes self-myofascial release and active isolated stretching, and functional flexibility, which includes self-myofascial release and dynamic stretching, can be implemented later in strength and power levels of the OPT model. So, in summary, flexibility training may decrease the chance of muscle imbalances, joint dysfunctions, and overuse injuries. It's important to have proper range of motion in all three planes. This can be achieved by implementing an integrated approach toward flexibility training. This integrated approach includes three phases of flexibility training: corrective, active, and functional. Corrective flexibility improves muscle imbalances and altered joint motion by using self-myofascial release and static stretching. This form of flexibility would typically be used in the stabilization level of the OPT model. Active flexibility improves the extensibility of soft tissue and increases neuromuscular efficiency by using self-myofascial release and active isolated stretching. Functional flexibility improves the extensibility of soft tissue and increases neuromuscular efficiency by using integrated multiplanar techniques that move through the full range of motion. The stretching techniques used in this phase include self-myofascial release and dynamic stretching. As a progression, active and functional flexibility would typically be used in the strength and power level.